Section 49 of Gray's Anatomy, Part 3. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information, or to volunteer, please visit LibriVox.org. Recording by Jennifer Stearns. Anatomy of the Human Body, Part 3, by Henry Gray. Lymphatics of the Abdomen and Pelvis, Part 2. The lymphatic vessels of the abdomen and pelvic viscera. The lymphatic vessels of the abdominal and pelvic visceral consist of 1. Those of the subdiaphragmatic portion of the digestive tube and its associated glands, the liver and pancreas. 2. Those of the spleen and suprarenal glands. 3. Those of the urinary organs. 4. Those of the reproductive organs. 1. The lymphatic vessels of the subdiaphragmatic portion of the digestive tube are situated partly in the mucous membrane and partly in the seromuscular coats, but as the former system drains into the latter, the two may be considered as one. The lymphatic vessels of the stomach are continuous at the cardiac orifice with those of the esophagus, and at the pylorus with those of the duodenum. They mainly follow the blood vessels, and may be arranged in 4 sets. Those of the first set accompany the branches of the left gastric artery, receiving tributaries from a large area on either surface of the stomach, and terminate in the superior gastric glands. Those of the second set drain the fundus and body of the stomach on the left of a line drawn vertically from the esophagus. They accompany, more or less closely, the short gastric and left gastroepiglottic arteries, and end in the pancreaticorenal glands. The vessels of the third set drain the right portion of the greater curvature as far as the pyloric portion, and end in the inferior gastric glands, the efferents of which pass to the subpyloric group. Those of the fourth set drain the pyloric portion and pass to the hepatic and subpyloric glands and to the superior gastric glands. The lymphatic vessels of the duodenum consist of an anterior and posterior set, which open into a series of small pancreatical duodenal glands on the anterior and posterior aspects of the groove behind the head of the pancreas and the duodenum. The efferents of these glands run in 2 directions, upward to the hepatic glands and downward to the preaortic glands around the origin of the superior mesenteric artery. The lymphatic vessels of the jejunum and ileum are termed lacteals from the milk-white fluid they contain during intestinal digestion. They run between the layers of the mesentery and enter the mesenteric glands, the efferents of which end in the preaortic glands. The lymphatic vessels of the vermiform process and cecum are numerous, since in the wall of this process there is a large amount of adenoid tissue. From the body and tail of the vermiform process, 8 to 15 vessels ascend between the layers of the mesenteriole, 1 or 2 being interrupted in the gland which lies between the layers of this peritoneal fold. They unite to form 3 or 4 vessels, which end partly in the lower and partly in the upper glands of the ileocolic chain. The vessels from the root of the vermiform process and from the cecum consist of an anterior and posterior group. The anterior vessels pass in front of the cecum and end in the anterior ileocolic glands and in the upper and lower glands of the ileocolic chain. The posterior vessels ascend over the back of the cecum and terminate in the posterior ileocolic glands and in the lower glands of the ileocolic chain. Lymphatic vessels of the colon. The lymphatic vessels of the ascending and transverse parts of the colon finally end in the mesenteric glands, after traversing the right colic and mesocolic glands. Those of the descending and iliac sigmoid parts of the colon are interrupted by the small glands on the branches of the left colic and sigmoid arteries, and ultimately end in the preaortic glands around the origin of the inferior mesenteric artery. Lymphatic vessels of the anus, anal canal, and rectum. The lymphatics from the anus pass forward and end with those of the integument of the perineum and scrotum in the superficial inguinal glands. Those from the anal cavity accompany the middle and inferior hemorrhoidal arteries and end in the hypogastric glands, while the vessels from the rectum traverse the pararectal glands and pass to those in the sigmoid mesocolon. The efferents of the latter terminate in the preaortic glands around the origin of the inferior mesenteric artery. The lymphatic vessels of the liver are divisible into 2 sets, superficial and deep. The former arise in the subperitoneal areolar tissue over the entire surface of the organ, and may be grouped into A. those on the convex surface. B. Those on the inferior surface. A. On the convex surface. The vessels from the back part of this surface reach their terminal glands by three different routes. The vessels of the middle set, 5 or 6 in number, pass through the vena cava foramen in the diaphragm and end in 1 or 2 glands which are situated around the terminal part of the inferior vena cava. A few vessels on the left side pass backward toward the esophageal hiatus and terminate in the pericardial group of superior gastric glands. The vessels from the right side, 1 or 2 in number, run on the abdominal surface of the diaphragm, and after crossing its right crus, end in the preaortic glands which surround the origin of the celiac artery. From the portions of the right and left lobes adjacent to the falciform ligament, the lymphatic vessels converge to form two trunks, one of which accompanies the inferior vena cava through the diaphragm, and ends in the glands around the terminal part of this vessel. The other runs downward and forward, and turning around the anterior sharp margin of the liver, accompanies the upper part of the ligamentum teres, and ends in the upper hepatic glands. From the anterior surface, a few additional vessels turn around the anterior sharp margin to reach the upper hepatic glands. B. On the inferior surface. The vessels from this surface mostly converge to the porta hepatis and accompany the deep lymphatics emerging from the porta to the hepatic glands. 1 or 2 from the posterior parts of the right and caudate lobes accompany the inferior vena cava through the diaphragm, and end in the glands around the terminal part of this vein. The deep lymphatics converge to ascending and descending trunks. The ascending trunks accompany the hepatic veins and pass through the diaphragm to end in the glands around the terminal part of the inferior vena cava. The descending trunks emerge from the porta hepatis and end in the hepatic glands. The lymphatic vessels of the gallbladder pass to the hepatic glands in the porta hepatis. Those of the common bile duct to the hepatic glands alongside the duct and to the upper pancreato-duodenal glands. The lymphatic vessels of the pancreas follow the course of its blood vessels. Most of them enter the pancreatorenal glands, but some end in the pancreato-duodenal glands, and others in the preaortic glands near the origin of the superior mesenteric artery. 2. The lymphatic vessels of the spleen and suprarenal glands. The lymphatic vessels of the spleen, both superficial and deep, pass to the pancreato-renal glands. The lymphatic vessels of the suprarenal glands usually accompany the suprarenal veins, and end in the lateral aortic glands. Occasionally, some of them pierce the crura of the diaphragm, and end in the glands of the posterior mediastinum. 3. The lymphatic vessels of the urinary organs. The lymphatic vessels of the kidney form 3 plexuses, one in the substance of the kidney, a second beneath its fibrous capsule, and a third in the perinephric fat. The second and third communicate freely with each other. The vessels from the plexus in the kidney substance converge to form 4 or 5 trunks which issue at the hilum. Here they are joined by vessels from the plexus under the capsule, and, following the course of the renal vein, end in the lateral aortic glands. The perinephric plexus is drained directly into the upper lateral aortic glands. The lymphatic vessels of the ureter run in different directions. Those from its upper portion end partly in the efferent vessels of the kidney and partly in the lateral aortic glands. Those from the portion immediately above the brim of the lesser pelvis are drained into the common iliac glands, while the vessels from the interpelvic portion of the tube either join the efferents from the bladder or end in the hypogastric glands. The lymphatic vessels of the bladder originate in 2 plexuses, an intra and extramuscular, it being generally admitted the mucous membrane is devoid of lymphatics. Footnote: some authorities maintain that a plexus of lymphatic vessels does exist in the mucous membrane of the bladder. Consult Médecine opératoire des voies urinaires par J. Eberin, Paris, 1909. End footnotes. The efferent vessels are arranged in 2 groups, one from the anterior and another from the posterior surface of the bladder. The vessels from the anterior surface pass to the external iliac glands, but in their course minute glands are situated. These minute glands are arranged in 2 groups, an anterior vesicle in front of the bladder, and a lateral vesicle in relation to the lateral umbilical ligament. The vessels from the posterior surface pass to the hypogastric, external, and common iliac glands. Those draining the upper part of this surface traverse the lateral vesical glands. The lymphatic vessels of the prostate terminate chiefly in the hypogastric and sacral glands. for one trunk from the posterior surface ends in the external iliac glands, and another from the anterior surface joins the vessels which drain the membranous part of the urethra. Lymphatic vessels of the urethra. The lymphatics of the cavernous portion of the urethra accompany those of the glans penis, and terminate with them in the deep subinguinal and external iliac glands. Those of the membranous and prostatic portions, and those of the whole urethra in the female, pass to the hypogastric glands. 4. The lymphatic vessels of the reproductive organs. The lymphatic vessels of the testes consist of two sets, superficial and deep, the former commencing on the surface of the tunica vaginalis, the latter in the epididymis and body of the testes. They form from 4 to 8 collecting trunks, which ascend with the spermatic veins in the spermatic cord and along the front of the psoas major to the level where the spermatic vessels cross the ureter and end in the lateral and pre-aortic groups of lumbar glands. The lymphatic vessels of the ductus deferens pass to the external iliac glands, those of the vesiculae seminalis partly to the hypogastric and partly to the external glands. The lymphatic vessels of the ovary are similar to those of the testes, and ascend with the ovarian artery to the lateral and pre-aortic glands. The lymphatic vessels of the uterine tube pass partly with those of the ovary and partly with those of the uterus. The lymphatic vessels of the uterus consist of two sets, superficial and deep, the former being placed beneath the peritoneum, the latter in the substance of the organ. The lymphatics of the cervix uteri run in 3 directions, transversely to the external iliac glands, posterolaterally to the hypogastric glands, and posteriorly to the common iliac glands. The majority of the vessels of the body and fundus of the uterus pass lateralward in the broad ligaments, and are continued up with the ovarian vessels to the lateral and pre-aortic glands. A few, however, run to the external iliac glands, and 1 or 2 to the superficial inguinal glands. In the unimpregnated uterus, the lymphatic vessels are very small, but during gestation they are greatly enlarged. The lymphatic vessels of the vagina are carried in 3 directions, those of the upper part of the vagina to the external iliac glands, those of the middle part to the hypogastric glands, and those of the lower part to the common iliac glands. On the course of the vessels from the middle and lower parts small glands are situated. Some lymphatic vessels from the lower part of the vagina join those of the vulva and pass to the superficial inguinal glands. The lymphatics of the vagina anastomose with those of the cervix uteri, vulva, and rectum, but not with those of the bladder. End of Section 49. Recording by Jennifer Stearns, Concord, New Hampshire.